the core problem, one of the big problems is, of course, long wait times in primary care. So maybe as the expert in this field, you can just let us know why. I know it's a tall order, but why? How did we even get to this point?
Right. Well, I'm afraid it's a fairly long-winded answer. But yeah, it does rather feel like the whole system is collapsing around us, right? Especially for those of us who can actually remember getting care in a timely manner as a matter of course. So, for example, I had a bad bout of bronchitis a number of weeks ago and could barely breathe. So I thought, time to make an appointment with my GP. So I got up my app, because I'm one of the lucky ones who actually has a GP. And the first appointment I could get was in 3 months' time. And my first reaction was, well, by that time, well, this either will have resolved or I simply won't be here any longer, which of course, is pretty much how most people thought about healthcare about a century or two ago. So why are things so bad? Well, it's useful to go back in time a bit and understand how the structures and institutions we have today evolved in the first place. So, interestingly, in the middle of the 20th century, Canada's healthcare system was very similar to that of the US. And then we gradually began to pull away and go down a completely different path. But the story actually starts a little bit before that, during the Second World War, when Ottawa came up with a set of post war reconstruction plans that included federal support for provincial health insurance. Now, Saskatchewan, assuming this federal legislation was imminent, pushed for a provincial plan that would work in conjunction with the federal legislation. And then, when the federal initiative actually fell through, Saskatchewan went, "Oh, well, let's go ahead with it anyway." And as we know, it became the first province in 1947 to provide public hospital insurance. And because that seemed to work well, the feds actually enacted legislation to support provincial initiatives in hospital insurance across Canada. And the principle of hospital insurance, in turn, was so successful that Saskatchewan then fought for a public provincial system of insurance for physician care outside of hospitals, right? Essentially, GP services. And again, Ottawa thought, well, hey, this can work. So let's support this federally as well. And gradually, by about 1972, all the provinces signed on to these two kinds of public health insurance. So, hospital and physician. But by the early 1980s, what was happening is that a lot of GPs were charging fees above and beyond the rates set for public insurance. So I can remember as an undergraduate always having to take an extra $10 with me when I went to see my GP because that's how much I would have to pay directly to my GP above the amount that my doctor would bill the province directly. And that's when the then federal minister of health, Monique Bigan, said, This just isn't right." And so, again, with the prodding of the NDP, incorporated these two existing pieces of federal legislation, right? One for hospital insurance, the other for physician services, combined them into what we now call the Canada Health Act in 1984. Now, this background is important to underscore two fairly important points. First, that so much of what happens in healthcare is really, in the end, up to the provinces. And second, that our healthcare system was really set up to deal with 20th century healthcare, and it's not working so well in the 21st century. I think it's probably worth emphasizing that first point. The provinces are the ones who determine what kind of healthcare system we get in each province. They have most of the legal responsibility to provide healthcare. But the problem is that they really can't afford all the healthcare that they provide. So, on average, federal funding accounts for about 22% of provincial health expenditure. Though, again, it varies by province. So, imagine what healthcare in your province would be like if you had 22% less funding, right? Basically, the provinces can tell Ottawa, you're not the boss of me. You're not going to tell me how to run healthcare. They could do that, but then they'd lose their health transfers, and then they'd either have to cut healthcare services a lot, or they'd have to cannibalize other provincial services to support healthcare. Either way, provincial voters would not be particularly happy. And so we're caught in this dance between federal and provincial governments on how healthcare should be funded and delivered. Then, of course, we can get in, if you want to, we can talk about the ways in which healthcare has changed, which again is a bit of a rabbit hole, but quite interesting.